I actually would say that if someone said, just rest and just give it time, is actually not very good advice. I always say that healing is a proactive process. It's not a passive process. You can't really sit around. Prevention is key. If we're on top of the side effects and we are trying to prevent them from even happening, then by the end of it, you can move on and then you're not trying to play catch up. That is ideal. Her energy went from like 5 out of 10 to like an 8 out of 10, just changing meal timing.
Facing cancer, Kicking Cancer's Ass brings you the stories, the science, and the strategies to maximize your power when you're facing cancer. Today, I'm very excited to welcome Dr. Jessa Landman. Welcome to Kicking Cancer's Ass.
Thank you very much for having me.
You are very welcome. So let's get right into it. Oncologists tell you when you're going through cancer treatment, you'll probably feel fatigue. And I think a lot of cancer patients kind of accept it reluctantly. It's part of the deal. What they don't expect is that it lasts longer than treatment and they don't get solutions. You've told me you have patients coming and saying, I need more energy. So this is your specialty, could you please explain what's happening that makes us so fatigued and how do you go about fixing it?
Yes. So, long answer to both of those questions. So, it always depends too on what someone has been through. So, obviously, very common for people to go through chemotherapy. Well, we know chemotherapy causes a lot of inflammation in the body. We know that it causes a lot of mitochondrial dysfunction. Mitochondria is what we call the engine of our cells, right? It's our powerhouse of our cells. So if you were to read a research article about what is causing cancer fatigue, you'll often see this chronic inflammation, mitochondrial dysfunction. So what do you do with that, I guess, right? There's not really a lot of solutions. You can do lots of things to lower inflammation, like different dietary approaches or different antioxidants, exercise decreases inflammation, sleeping properly, all that. But what I have found is it's really like my approach is a head to toe approach because it's very different for each person. So, for example, you talk a lot about like breast cancer survivors. So, breast cancer survivors who have to go on hormone treatment, for example, well, suddenly they might be thrust into menopause. And so they're having hot flashes. And so maybe that keeps them up at night. Maybe they are peeing a lot in the middle of the night, and that wakes them up a lot. Maybe they have joint pain that prevents them from sleeping. And not everyone gets all of the same side effects, right? So it is very individual. So so for those types of women, we need to say, okay, what is it exactly that is interfering with your sleep, for example? Or
So
let's
the
say,
first,
mhm.
so I just wanted to ask, so the first step, I guess, of what you're looking at with fatigue sounds like it's sleep hygiene.
One of the first. So I would say if I was to look at like I'm doing an overall assessment for patients, one of the first things that I'm asking is, what exactly was your treatment regimen? So someone who went through chemotherapy, or maybe it was just a couple surgeries, or maybe it was radiation to the brain, for example. All of those are going to cause very different symptoms for people. So understanding exactly what they went through. Obviously doing a very thorough workup with different blood work, looking at, of course, like thyroid function. If someone is anemic, that's very important. And then, probably most importantly, is getting into the lifestyle stuff. So, number one, actually, that I assess is nutrition. So, and again, kind of with the lens of women with who are breast cancer survivors, and as you probably know, there is a ton of information on the internet about what you should eat after you've gone through cancer. And a lot of women make, a lot of sometimes drastic dietary changes. So maybe they become a vegetarian, or maybe they're doing fasting, or they're trying different keto, or different types of diets, or they've cut out this or they've cut out that. And so maybe they're just not eating enough. Maybe they're not getting proper nutrients. Maybe they are protein deficient. So it's really like a very in-depth analysis of what are you actually getting. So that would be number one. Number two is we have to always address physical activity and movement. And that's a really tough one because When someone is fatigued, it's very hard to get that motivation to, to do anything. And so, I work very closely with people about trying, increase their motivation to increase physical activity, even just the education piece about, hey, if you move, you're going to increase your muscle mass. When you have more muscle mass, you have more mitochondria. That's going to give you more energy. And sometimes people just don't even really understand that piece. And so that can sometimes be very motivating. So physical activity and then sleep would probably be, and it's not in any kind of order of importance, but
Mhm.
definitely sleep, of course, would be like third. Yeah.
Yeah, I think it's really interesting. I think most people have no idea what mitochondria are, let alone what they do or that they can impact them.
Hmm.
And I think people also, you get so scared that, did I do something to cause my cancer, which you didn't? Is there something I can do to prevent my cancer? And we've had on Dr. Jay Harness, we've talked about exercise oncology, and it turns out a number of studies were released this past year in 2025 about exercise is a phenomenal way to reduce recurrence risk. So I'm
Yeah.
sure there's mitochondrial reasons for that.
Yeah, probably mitochondrial reasons for sure. And then, so of course, y- and then of course all the other pieces that exercise does for you. So if it's improving your mood, for example, it improves sleep. It does improve energy. If you're out exercising, often that involves more social connection, which also is sometimes a really underestimated part of, activity and just feeling that when people aren't so isolated and they're back enjoying the things and with their friends and having laughter, that's also a really important piece for, mood and recovery as well. So I wouldn't, I would like to think that also has a role in recurrence too. So yeah.
Well, and it's interesting because you were talking about fatigue, and I know you're not a mental health professional, but isn't fatigue also a sign of depression and mental health issues? Is that part of your workup to try to understand where the person is psychologically?
Yes. And so and that's exactly what I do when I'm assessing fatigue. So it's like the treatment, of course, like the diet, physical activity, sleep part of it, but also, did you gain weight? Did you lose weight? How is your mood? Do you have an intense fear of recurrence? Are you anxious and you can't sleep? Or are you depressed and you sleep all the time? And so how you approach fatigue with someone, it's very individualized. Trying to help someone who's anxious, who can't sleep, I would do very different things for that person as opposed to someone who's depressed and is sleeping all the time. So same experience of fatigue, but the root causes, I guess, are a little bit different and unique.
Well, and what I love is you don't say to people, you know, chin up, you just beat cancer. Like fatigue, if that's the worst of it, right? Like nobody should have to live feeling exhausted all the time.
Mhm, mhm,
So you talked about sleep, you talked about food. One of the things you've mentioned to me is you also do IV therapy.
mhm. Yes.
And I'm sure not for everybody, but what is the research about IV vitamin C therapy and improved survival rate? And can you explain how it works in the body and why someone might be a good candidate for that supplemental complementary treatment?
Yeah. So, you said what was really interesting is that also just this year in 2025 was the first ever meta-analysis of intravenous vitamin C that was published. And so, if anyone doesn't know what a meta-analysis is, it's basically when researchers take, all of the studies that have been done about a particular topic or subject, and they don't quite average it, but like kind of, they kind of combine it and like, let's see what's the big picture here with this type of therapy. And they do this for chemotherapy, immunotherapy. We want to have a meta-analysis is considered like the top echelon, I guess, of research. So it's very highly regarded. So finally, there's been enough research into intravenous vitamin C that the first meta-analysis was published, and it did show that people who used intravenous vitamin C alongside conventional therapy, so that was either radiation or chemotherapy, most commonly, I believe, um, had improved overall survival rates. So if I was to say who would be a good candidate for it, it would be possibly anyone who's going through active treatment, because how it seems to work is that it is actually complementary to chemotherapy and radiation. So how it works is it actually turns into something called hydrogen peroxide, which is a free radical. If anyone doesn't know what a free radical is, it's basically the toxic things inside the cell that cause cell damage. And so when you kind of add that free radical to the effects of chemotherapy and radiation, it's kind of like an intensified treatment, if you will. So we think that they actually play play very well together. So people are having better response rates.
So we had Dr. Lise Alschuler, also a naturopath, on earlier in the series, and she explained that vitamin C orally or in grapefruit or what have you actually has a different acts different in the body than the high dose IV vitamin C. So you're not saying that, hey, vitamin C improves the survival rates. The studies were on high dose IV vitamin C, correct?
High dose IV, yeah, and she's right, and that's very a very key difference is that when you're taking it orally, it does act very differently. So maybe it's good for colds and flus or things like that. But then when you read studies on IV, the high dose intravenous vitamin C, they actually refer to it as pharmacological vitamin C. So kind of like the drug form of vitamin C. So in a really, really high doses, it behaves very differently. And that is where, I think most of the misunderstanding with vitamin C comes from. A lot of people be like, "Oh, don't do the high dose because it's an antioxidant." But it's actually the reverse. So when it's at really, really high doses, it's an oxidant. So it's causing damage. Yeah.
Okay.
Yeah.
And is that only appropriate in treatment, or is it something if you're post-treatment and you're trying to get your groove back on, you're trying to start to feel energy and vitality and everything that makes life rich, is this part of the protocol or not really?
Yeah. So the really cool thing about when people are doing IV vitamin C at the same time as chemotherapy, and there was I think it was in 2022 or 2023, there was a great study that was done in women who had breast cancer who were undergoing chemotherapy at the same time as vitamin C. And they also found that their side effects and quality of life was better. So not only are people, getting the benefit of the high dose vitamin C for fighting cancer, but they have better energy, they had less nausea, less pain, better sleep, and better appetite. So the whole idea of integrative oncology is to try to prevent side effects or minimize them, or so they're not so I guess, like, not so intense and not so bad. And so when you're done treatment, you're actually not feeling so worn out. And so when you're doing the vitamin C, you're preventing those drops in energy. You're sleeping better, you're eating better, and then treatment is done. And oftentimes, I'm not going to say you're feeling exactly the same as you did, but you're not feeling as badly, I guess, as if you didn't do the vitamin C. So for someone maybe who didn't they chose not to, they felt uncomfortable. Of course, yes. So for recovery, you can do the high dose vitamin C to help with the recovery of those side effects, specifically fatigue, if we're going to talk about that, because that is one thing that the high dose vitamin C does is decrease inflammation. And we know that inflammation is probably one of the main root causes of most of the side effects of cancer treatment. So diarrhea, brain fog, sleep, pain, fatigue. And so when you decrease inflammation, you're helping your body to heal and feel better. So in both scenarios, it would be helpful.
So in the town I live in, there's a IV storefront, right? We'll do IV fluids for you. How does somebody know that they're getting pharmacological grade, high quality IV vitamin C?
Yeah, I know these IV bars are kind of, popular. They advertise for, anti-aging or, different things like that. I would say that the practitioners the practitioners, sorry, who I know who are delivering the high dose vitamin C are probably naturopathic doctors who are trained in integrative oncology. So if someone was interested, I would say, to search out someone who's really experienced with that treatment specifically.
Makes sense.
Yeah.
All right. So I know it drove me crazy, and I've talked to lots of survivors. You finish treatment, and the health system's like, "Good job, you're done," and you're supposed to bounce back, and then you find out, you might have bone density loss, or heart issues, or hormonal chaos. How should someone navigate the life after cancer phase when they've been told by their doctors, treatment's done, you don't have cancer?
Yeah. Yeah, so for those specific things, I guess in my experience with patients who, might have been exposed to a treatment that, could have had, detrimental effects on their heart and bone density, they're usually getting, a yearly DEXA test, so that's a bone density test. They're usually also getting yearly echocardiograms to check for heart function. So maybe the healthcare, the follow-ups is different in different jurisdictions, but those things don't usually have like the ball isn't usually dropped on those more serious things. There usually is follow-up and then therapies to address those
Mm.
things. Like for bone loss, it might be a bisphosphonate therapy, or just counseling about like exercise and vitamin D and things like that. So specific things I would hope would be very diligently followed up with. But like the bigger picture, I think you're talking about too is like, yeah, you're done, you're live, and just be grateful and good luck to you kind of thing. And the aftercare, you're right, it's a bit of a gap in medicine. So how do
Mhm.
people address that? Well, certainly having a good relationship with any kind of, well, I wanna say naturopathic doctor or, a functional medicine doctor who's trained in functional medicine and looking at the big picture is really key because you need someone who is going to listen to you seriously and investigate and be knowledgeable about what can help. So let's just say you have that person and they, give you a treatment plan. Just thinking like, what I do for patients, and the first step is, I probably like navigating it would be taking it a bit more slowly than you might want to. And
Mm.
so, yeah, so some people want to dive right back into whatever, exercise regimen they were doing. Well, that's gonna take some time. Or they want to just dive right back into work. Well, maybe that's overwhelming. Or maybe they have certain things in their life where the responsibilities they can't really avoid. They're a mom, or they're taking care of aging parents, or they have certain job responsibilities, and you can't get away from that. Those sometimes are things that are a little bit more, out of our control. But being really patient and really gentle, and I don't mean that in the sense of like rest and doing nothing. I actually would say that if someone said just rest and just give it time is actually probably not very good advice. I always say that healing is a proactive process. It's not a passive process. You can't really sit around. And so yeah, so that, slow, like definitely slow steps. And then I don't know where to go from here in terms of
Mm.
like, what's the next step? Because like this is I work so closely with people and I develop like really kind of long-term treatment plans, and it's always very individual. So, I'm always looking for what is and it's never a one size fits all approach, right? It has
Sure.
to be very individual. So what is it that's going on for you? Sometimes making really like specific goals as well. So in the coming year, I want to feel like this, or in the coming year, I want to be able to do this again. And so maybe that is, run a 5K, or maybe that's just play with my kids and not have my knees hurt when I'm down on the floor, And so having very specific goals and then trying to sometimes address just one thing at a time.
So I'd love to hear, if you're comfortable sharing, obviously no names,
Mhm,
just a success story. Like someone came in, this is where they were at,
mhm.
and here's where you got them.
Yeah. So sometimes it is really simple. So I'll give you a very recent one, just a woman I had a couple of weeks ago, actually. I saw her for her last follow-up a couple of weeks ago. So she came to see me. She was about 3 months post-treatment
Mhm,
chemotherapy. Her main thing was joint pain and fatigue, constipation, and poor sleep. So, okay, so where do you start, right? So I started, we started by looking at her life, and she was still off work, hadn't gone back yet. But she tried to just do things around the house during the day, and both her boys were very busy baseball players, softball players, I guess, teenage boys. And so her evenings were spent driving them around and then ended up really like eating late at night. Like she said, she didn't have much of an appetite during the day. Dinner time was always late at night, maybe like 8 or 9 p.m.
mhm,
And so it took some convincing, but I was like, well, so one, we need to eat more consistently during the day. So food does give us energy, so we need to have that energy during the day. I explained that when we're eating late at night, sometimes that can actually interfere with our sleep because our bodies are too busy digesting and won't let us sleep. And it can also contribute to constipation, eating too late in the evening as well. So we simply changed the time of the day that she was eating and focused really on like high protein, anti-inflammatory foods as well. Her main meals of the day started being breakfast and lunch. And we was like, you need to eat before you go and pick up your boys. If your boys want to eat late at night, you feed them, but you have like an earlier dinner so you're not eating late.
mhm,
And that was just one very easy kind of like simplistic example of what worked. So suddenly she was eating at kind of like, more common or like more in line with like the circadian rhythm when your metabolism
mhm,
is highest with breakfast and lunch. She was sleeping better because she wasn't like just her body wasn't busy digesting, and her bowel movements actually became normal. Her energy went from like I think it was like a 5 out of 10 to like an 8 out of 10 just
great.
just with that, with actually just changing meal timing. And then the next thing we started working on was her joint pain, and we were doing acupuncture. So she was on tamoxifen, and acupuncture is it's actually endorsed by the American Society of Clinical Oncology for the treatment of joint pain induced by those breast cancer medications. And so we did some acupuncture for it was mostly her knees and hips. Her hips, it was hard for her to get comfortable at nighttime, and it worked very well. So her pain was like mostly managed. At her last follow up, the acupuncture had also maintained as well. So that's kind of an interesting thing about acupuncture is sometimes you don't actually have to go all the time. You can go for a series of treatments, and it can be very, very long lasting. So
That's fantastic.
that was just a very simplistic example that sometimes like, oh, that sounds too easy, but sometimes it is just those little things.
Well, and as you said, it's personal, and it depends on your life, your lifestyle, what your what you need.
Mhm.
So, you have said that you believe people should be able to live a normal life during cancer treatment. I actually agree 100% and did so. So, it's bold, but it's absolutely possible. How do you how do you make that a reality for most people that come to you?
Yeah. So I mean, I don't know if I would tell my patients that I think you should be able to live a normal life. I would love to hear your experience of if that was your experience.
Sure.
I do often say to my patients though, like as good as you might, like much better than you might expect, and maybe as normal as possible, in the fact that you might be able to feel okay to continue to go to work, or still feel okay to like it's not the picture that you have in your mind of like I'm gonna go through chemo, for example, and the image that we have in our mind. I'm gonna be sick, I'm gonna be, throwing up and nauseous and lose weight and all those things that we imagine. So yeah, it is a bold statement, but I do see it, and likely you probably experienced as well. And I think it is, I mean, the people who just, I guess, the name of your podcast is like kicking cancer's ass.
Mhm.
The people who go into it with that attitude of, "I'm gonna kick cancer's ass," no, I'm not gonna be tired today, I'm going for that run. No, I'm not going to, let this, like, overcome my emotions. I'm gonna go out and have lunch with my girlfriends today. Like, trying to maintain a normal life as well, where you're not just sitting at like, for example, people don't work, they're sitting at home and their mind is their main companion.
Mhm.
Real
They're dwelling in it. So
real dan
you asked you asked me a little bit about mine, and obviously I'm not a naturopathic oncologist, I'm not a doctor. I'm just a multi-generational cancer survivor. We've had 12 different cancers throughout my family, and I was number 12. So, like anything else, there's pattern recognition. So, there were 3 elements of why I lived as a normal life. One was approach, one was mindset, and one was happiness tripwires. Approach was, I got myself to a national comprehensive cancer center. So find the people at the cutting edge. I actually had a fairly I mean, triple negative, uh, stage 2A. Like, it wasn't particularly complex, or it was just aggressive. So, but I wanted the best care I could get. So I found a great team. But I also was very deliberate and proactive about side effect management. So this probably is where a naturopathic oncologist could have been a great member of the team. I was a DIY at the time. So, keep my hair, cold capping, nausea. How do we have to adjust my diet to take out foods that are likely to cause more nausea? And I actually got Apripant, which is known as Emend or Cinvanti. I asked for that as opposed to Zofran and some of the others because I knew that those didn't work that well for my body. But I stayed ahead on nausea. I stayed ahead on hair. I stayed ahead on fatigue by listening to my body. I stayed ahead by keeping my exercise routine. So I already was lifting heavy weight and doing aerobic exercise. So I'd lift 3 times a week and I'd do something cardio 2 to 3 times a week. So I kept doing that, and I always did it with my friend. So we kept doing that, and that routine really helped. The other part about the approach was I was able to box cancer into 1 day a week. Now, I work remotely, so if I needed to be working from the couch because I just was a little tired, I'd do my work from the couch. And my clients, everybody was comfortable with that. If my work was on my feet in an office, what have you, that might have been harder. 2 was mindset. I never had any question that I was going to beat this. Like, and when people said, "Do you want to talk to so and so? They had breast cancer." I said, I have a built-in support group of people that have my genetics, my pathology, and my mother's a 43-year survivor and my sister's an over 20-year survivor. So I'm pretty good on that. And then the last part was an accident. And the accident was I knew that infusions could be a hard day. And so I started seeking out and creating ways to make it less difficult. So an example is I named my port, and then I'd introduce everybody to Voldeport, and they'd laugh, right? And we're laughing because it's funny.
Yeah.
And I had a set of prayers that I'd listen to, and they were musical and they made me happy. One of my sons sent me a Spotify playlist. The other one would send me a letter at every infusion that I'd read. It was digital, but it was my digital chocolate. I had different friends driving me or bringing lunch, just little moments of joy. And it turns out that these microdosing of happiness, what I call happiness tripwires,
Mhm.
and I didn't have to make them up. Like, people, it was like people ask once, "What can you do?" You tell them, and they do it. Like, one of my friends sent a text every infusion of 3 kissy face emojis. That was the entire thing. Who cared? It was great. And so it's releasing serotonin, dopamine, and oxytocin which are making me feel more energized, yay, making me feel clearer, awesome, and boosting my immune system. So that was my magic formula.
Yeah. And so were you aware of, like therapies to help with the like being on top of the side effect management already, or did you just educate yourself on your own?
Again, because when you're multi-generational, you've seen all the side effects. So when I was worried about neuropathy, I was doing the ice mittens and the ice socks, but I found that was the thing I could tolerate the least. And so I started to get some tingling, so I started to use acupuncture
Mhm.
to try to mitigate and hopefully reverse any neuropathy, right? So I did massage. I did mental health. I had a psycho-oncologist. I spoke to a nutritionist, and we made sure that my diet was optimized to keep my very sensitive GI tract from being a complete nightmare. And it had its moments of nightmare, but I did not know about IV vitamin C. I, so I'm still learning.
Yeah.
And if God forbid I have to do it again, yeah, I'd add that to the mix.
Yeah. Yeah, for sure, and the IV vitamin C can definitely be helpful for the side effect prevention, like I mentioned, but it's not vitamin C or bust. You mentioned all the things, right? So acupuncture, there is research for helping with sleep or hot flashes or nausea or diarrhea, constipation, heartburn. You name it, you can do acupuncture all throughout your treatment. So, and kind of like just going back to your question, like how do you help people maintain a normal life? It's ideal if you catch them before they get into treatment, kind of like what you did,
Mm,
and explaining, prevention is key. If we're on top of the side effects and we are trying to prevent them from even happening, then by the end of it, you can kind of just like, okay, that's done and move on. And then you're not kind of trying to play catch up. That is ideal. If someone didn't know about integrative therapies, then it's maybe more of like a rehab type of case, which is still possible. But the experience is very different when you go through
very.
it and you're like, I'm actually feeling pretty good. And I see my patients weekly. I'm always checking in with them. And it's like, yeah, maybe different stuff. Like so maybe ginger for nausea or the acupuncture, or of course, very intense, dietary advice, making sure, whether it's like high protein or eating frequently or not doing any kind of crazy dietary restrictions as well.
Mhm.
That's also very important too, and just nourishing yourself. The connection, like you said, the joy, the laughter, all of those things. So yeah, so good for you.
Yeah. Yeah, I mean, you asked why I wrote the book. I wrote the book because all of my doctors said, "You're doing this differently." But what I loved about what you just said is it aligns with something I try to tell everybody, which is the best way to deal with side effects is to stay ahead of them,
Yeah.
prevent them in the first place,
Yeah.
because once you're fatigued, it's harder to get out of it. Once you're nauseous, it's harder to get out of it. So you have to be proactive, and it's not weak. It's not hypochondriac to say, I would like not to feel like crap. So, let's talk about what's within our power. And our can be however big you draw that circle with integrative oncology and naturopaths, with acupuncturists, with your oncologist. I don't care.
Yeah.
Draw your circle and advocate for, I want to feel good. And the interesting thing, and I said this on, I did Dr. Jay Harness's podcast, and I love lifting. I loved lifting during treatment. And my sister's a trainer, and she trained one of her friends during treatment. And we both had the same response. It was like an FU to cancer. It was, look how strong I actually am, even if, I'm not as strong as I was, when I wasn't going through chemo. And it really pissed off my friend because she's like, I hate that you're going through chemo and you're still lifting more weight than me.
Yes.
Like,
Yeah.
what is wrong with this?
Yeah.
But it was part of my like flipping the bird
Hmm.
to cancer, which is like, you're not going to keep this down.
Hmm.
And I will tell you, like after my surgery, I went and I again, staying ahead of it, I got fitted for compression sleeves to try to prevent lymphedema,
Mhm.
right? Which I think that acupuncture is, and that's another thing
It
that
can.
acupuncture can help with.
Yes.
But when they were examining me, this is 3, 4 weeks post-surgery, they wanted to see my range of motion and my strength. And so I put my hands over my head, and she's like, "Oh my God." And then she put resistance against it, and I'm fine. And she said, "Okay, that never happens." And I said, "Do you have patients much older than me?" She goes, "No, they're usually in their 40s and 50s. Like, you're right in it."
Mm.
But my thing was, yeah, if you're doing pull-ups during chemo, odds on your shoulders are keeping their range of motion.
Yeah. Yeah, and it is getting better. So the advice is getting better. Like more
Yeah.
and more big cancer centers are, learning more, being educated more, have staff who are knowledgeable about what to do. But I do still sometimes hear, I had recently had a patient who said, I used to love yoga, but, my doctor said I should probably avoid it. Because I think it had something to do with being in a closed room and being more likely to get sick. But so she was just terrified of being kind of anywhere, at
Mm.
gym or anything, and didn't exercise at all. So you have to also be careful, how it lands, right? Because I'm like, the advice to avoid any kind of exercise is, not what we should be telling patients. It should be like maintain what you're doing. You don't need to decrease. There's no reason to. If you're feeling too fatigued or you have any kind of pain, right? Pain is always our body's signal to slow down a little bit, but otherwise there is no reason why you shouldn't be able to continue doing what you're doing. And so, yeah, and a lot of people still just don't know that, oh, I can exercise or I should. And here's all the, research as to why it's going to help, or here's different supplements, or here's how nutrition is going to help, or, here is how, yeah, maybe even if it's just therapy, right? And staying
Yeah.
connected. So it's I
Well, and I think the concern of being in a hot yoga room, maybe they're so immunocompromised it is a risk.
yeah,
That doesn't mean stop doing yoga. It means let's look for an alternative way for you to do yoga. And
exactly.
even if that means have one friend come over and you do it using a online
Yes,
yoga.
that's
But
all key.
the point is to do the exercise and to try to make it a little bit social, not necessarily like I didn't spend my time in a Gold's gym,
Mhm.
right? I was able to work out in my garage.
Mhm.
But if you have to go to a gym, okay, there's times they're less busy. There's all these ways of thinking expansively about how do I solve this problem. And if all you can do is take a walk, a brisk walk, what I did when my sister was diagnosed, she had a new primary right after I finished treatment.
Mm.
And we set up a spreadsheet of walk with my sister. And she decided who she wanted. It had dates, times, and I sent it out to her friends, and they signed up. She said, "I feel a little bit like the dog, but someone shows up every day to take me for a walk."
It's awesome. Yeah, yeah. That's great. Yeah.
Right? So, okay, let's talk about your book.
Okay.
You have a book, Beyond Cancer Fatigue: A Path to Reclaiming Energy. I mean, thank you for writing it.
Yeah.
I know it's coming out in April 2026.
Yeah.
So give us a little preview. How can survivors identify the unique factors draining their energy? And what tools do you recommend they start with?
Mhm. So I kind of talked about it a little bit already, but the book is really so hasn't been a book written about fatigue. And I guess it is because I in my practice I noticed that it is, the main like the number one thing that people come to me looking for help. And then I've had really good success helping people. I had been saying for years, I need to write a book, kind of like what your doctor said to you. So I finally did. I really hope it helps. And so it's meant to be So I mean, I would prefer if people read it from cover to cover. I know sometimes that's hard for people, but even if it's starting with a chapter on, okay, what is most going to be affecting you. So, the intro chapter talks about the model. It's called the 3P model, and so it's about things that were maybe present before treatment, things that treatment did to you, and things that are happening after treatment that might be perpetuating it. So maybe before treatment, you already had very low energy. Well, we know that that's going to make it worse. Or again, looking at, the effects of treatment itself, like inflammation. And afterwards, maybe someone's not exercising or eating properly, or maybe they're very anxious. So trying to start, identifying what was really resonating with people. And then it directs people to go to the chapter that you also think might be most impacting you first. So let's say it's pain. I have a lot of joint pain, or I have post surgical pains, or pelvic pain from radiation for ovarian cancer, or headaches or something like that. Then go to the pain chapter if that is like your number one. If you ask yourself, what would be the number one thing that I think I could address right now that might help me? We know that pain and fatigue are highly linked. Pain, fatigue, often depression, and poor sleep. So sometimes, if you just start addressing pain, well, then sometimes someone's sleep might automatically get better. And sometimes then their mood is uplifted. So it can often be, a real snowball effect, just going after the first thing. Or then there is, a whole chapter on, like, let's say you're a breast cancer survivor, go to the menopause chapter first. Or if you're a prostate cancer survivor, go to the chapter on testosterone and, how to help men, get over certain symptoms. Maybe it's urinary incontinence or weight gain or something like that. There's
Great.
very specific chapters about you might want to, like again, depending on what type of treatment you went through, have you been assessed for thyroid dysfunction, or have you been had a full workup for diabetes, for example? Those things are also very common after treatment and sometimes don't always get assessed properly. So sometimes it's ruling out those obvious things on blood work is sometimes the first place to go. Yeah.
Great. Well, I'm sure it's going to be a very useful reference for people.
Yeah.
And if they do read it end to end, again, stay ahead of the side effects. They're easier to deal with proactively
Mhm.
than reactively.
Mhm.
All right, Dr. Landman, Jessa, we're going to do the lightning round.
Okay.
These are 5 questions. You give quick answers,
Okay.
um, and we'll just have some fun. So complete the sentence. The biggest myth about fighting cancer naturally is.
That it's an alternative to conventional treatment.
This is a both and, not an either or.
Both and for sure.
All right. What is your advice for someone looking to kick cancer's ass?
Well, kind of like what I already said too, go into it with that mindset. Get up every day and say, nope, I'm not going to let cancer make me too fatigued today. I'm not going to cry all day. Same with your mindset. I'm going to get out there. I'm going to be tough. I'm going to lift those weights. I'm going to just defy. I guess an attitude of defiance. That's what I
Mhm.
like. Kicking ass is like I'm just going to defy the narrative.
I agree because the narrative is cancer as a plot device,
Yeah.
and it's never a uplifting, positive plot device.
Yeah. Yeah.
Even though I will tell you, every person I've interviewed on this show and interviewed for my book and talked with after treatment, after maybe they've recovered from the fatigue, what have you, they all look at it and they say, I would never choose cancer, but I'll be damned if it didn't make my life better.
Mm. Yeah, a lot of my patients have that reflection as well. And I think if you can have some sort of meaning to it, it's often very helpful.
I agree. And even if the meaning is I connected with the people who love me and who I love,
Yeah.
like that's enough. We don't have to write books, do podcasts, change the world. You can just be reminded that you love deeply and people love you.
Yeah. Yes.
All right. If you could add one integrative therapy to every cancer center tomorrow, what would it be?
An acupuncture program.
That's great. And make the appointment early because they get booked out.
Mm-hmm. Mm-hmm.
All right. one thing every cancer patient should do to manage fatigue?
Don't underestimate the power of daily movement and physical activity.
I was gonna bet you were gonna say something along the lines of exercise.
Yeah.
Okay, is there any supplements that every cancer patient should ask their doctor about?
Okay. I know it's supposed to be quick. Every is tough. Every is tough because I'm always used to working through a lens of, like individual therapies. But if everyone was to ask, I would say maybe ginseng. So there's good research with ginseng, immune function, stress, helping with sleep, helping with energy. Lots of really great research with ginseng. So ask about that.
And always tell your doctors what supplements you are taking or want to take
Yeah.
because there are some that are contraindicated.
Hmm.
And, you're not a doc I'm not a doctor, you are.
Hmm.
But I often tell patients, people like, don't play doctor, not even with ChatGPT. Go tell your doctor. For example, I took athletic greens and it kept my very sensitive GI tract happier. Okay, congrats to that. But I told my doctors and they said, "Okay," and they looked at it, they said, "This is all right. It does have a little bit too much oral vitamin C, but we don't think it'll be a problem." And then during treatment, I said, "Well, I'll find a different super green." I didn't like it as much, but it had lower vitamin C
Mm.
and had the same benefit to my GI tract, and then once I was done with treatment, switched back to the one that I preferred.
Yeah, for sure. I mean, there's often this thought that herbs or supplements or vitamins are just completely benign, and they're not. So especially at really high doses, they can have really powerful effects. They can definitely have side effects. And sometimes, they actually might put strain on the liver, for example. So yeah, it's important to have that discussion and not I always say, don't self-prescribe. Definitely seek out an expert in the area because there is a very big role for supplements. And there's a time and a place for each one, I would say.
That's great.
Mhm.
Well, this was awesome, and people can look for Beyond Cancer Fatigue, A Path to Reclaiming Energy, coming in April 2026 by Dr. Jessa Landman. It'll be available, I assume, everywhere books are sold.
Yeah, it's actually available for pre-order on Amazon right now, I just saw.
Excellent. So you can go on to Amazon and get out there and move. Whether you're facing cancer or not, get out there and move. It's good for you. Thank you for being on Kicking Cancer's Ass.
Thank you so much, Joelle.